The Bone Marrow Garden with Dr. David Margolis. Brought to you by Aplastic Anemia-and-MDS International Foundation.
What is bone marrow? Inside our bones is a soft, spongy tissue called bone marrow. It is the garden that makes blood cells. Bone marrow contains special cells called stem cells. These blood-forming stem cells grow and mature into the three types of blood cells. Red blood cells, which carry oxygen to tissues and organs, white blood cells, which help fight disease and infections, and platelets, which help clot blood to stop bleeding.
Who is David Margolis, MD? Dr. Dave received his medical degree from the University of Wisconsin-Madison in 1989. He is a professor of pediatrics at the Medical College of Wisconsin-Milwaukee. Dr. Dave is the program director of Children's Hospital of Wisconsin Blood and Bone Marrow Transplant Program. Dr. Dave, talk to us about bone marrow failure.
Hi, I'm Dave Margolis, and we're going to talk about the Bone Marrow Garden today. So I find thinking about bone marrow as a garden is a really good way to explain to kids and adults what's happening in your bone marrow. So I view the bone marrow as a garden. I'm from Wisconsin, so everything's farm related, garden related. So I don't draw very well, so please bear with my writing. So there's our bone marrow garden, and if you're starting a garden, the first thing that I put in the garden are seeds. So we have our seeds. So our fancy word for the seeds are the blood stem cells. So we have blood stem cells, and they're in our garden, and they're our seeds. And those seeds turn into flowers. And in our bone marrow garden, we have three main types of flowers. Red cell flowers. Red cells carry oxygen. They give us strength. They take the oxygen from the lungs to the rest of the body. White cell flowers. White cells help us prevent from getting an infection. They help us prevent getting a bacterial infection. They help us prevent getting a fungal infection. They help us fight viruses, different kind of white cells. And then finally, we have the platelet flowers. Platelets help us prevent bleeding. So when we get a cut, those platelets go there, and they help us stop bleeding. So when we're healthy, our bone marrow garden works really well, and you don't even know it. And our seeds keep on getting planted, and they keep on making those flowers, and everybody's good. Well, sometimes bad things happen to gardens, and we'll talk about a couple different things that happen to the garden. Let's talk about aplastic anemia first. So in aplastic anemia, what happens most of the time is that one of the white cells, called the T cell, T stands for thymus, but some of the kids that I've talked to have decided that the T actually stands for traitor. And so the reason that the T cell is a traitor is instead of fighting the virus that it's supposed to hit, it starts attacking those blood stem cells. So the traitor cells are attacking those blood stem cells. And when that happens, the blood stem cells go down in numbers, and then when we have fewer seeds, unfortunately, we start having fewer flowers. And when you look at a bone marrow under the microscope, it looks just like an empty garden. And that's what it is. There's not enough flowers in the garden. You don't have enough red cells. You don't feel strong. You feel weak because you're anemic. You get tired easily. You look pale. Not enough white cells. You can't fight the bacteria. You can't fight the fungus. You can't fight the viruses as well. No platelet flowers, you start bleeding too easy. You get those little red dots called petechiae. You get a nosebleed easier than you should. And you present to the doctor and you get diagnosed with aplastic anemia. And aplastic is just a fancy word for empty. And so we've got an empty garden. So how do we make you better when you have aplastic anemia? Well, it's not that hard. We have to fix the garden. So the way we fix the garden is to First thing we do is give medicines to attack the T cells. That's what we want to do. So we use immune-suppressing medicines to attack those traitor cells, those T cells. Depending on how you're treated, it may be one kind of medicine or another kind of medicine. We either ask that your own stem cells, your own seeds, grow back. And if you get ATG and you get better, that's what happens. Your own seed cells make your flowers. If you need a bone marrow transplant, then you get somebody else's. Either a brother or sister, another relative, or somebody you've never ever met can give you those seeds. So new seeds leads to new flowers, and you feel strong again. You get your red cells, you get your white cells to prevent infections again, and you get your platelets back so you don't bleed. And then you're all better. So that really, I find that the garden helps everybody understand what happens with aplastic anemia. Now, there are other diseases that can affect the bone marrow. So let's go back to our healthy garden with lots of seeds. In Myelodysplastic Syndrome, or MDS, we think that the problem is really in the seed cell. That's how I think about it. That's how I explain it to kids. And so the way you fix Myelodysplastic Syndrome is you figure out ways to fix the seeds. And there are some medicines that can help fix seeds, and sometimes you also have to do a bone marrow transplant. But when you have a sick seed cell, sometimes you get sick flowers as well. And so that's one of the ways we think about Myelodysplastic Syndrome and the garden. Now in PNH, another disease that people have that affects their blood counts, it really is more of a problem out here in the flowers. That's the way I think about it. And so we sometimes have to fix the seeds to fix the flowers, but sometimes we don't need to. And so in PNH, it's a little bit harder to quite go with the garden story, because it's oftentimes more of a flower problem. Now, very commonly, either one of your friends or one of your relatives will have a disease called leukemia. And I think it's really important to separate out aplastic anemia from leukemia. In leukemia, what happens is the garden gets full of, you got it, weeds. So what happens is you get weeds, which are really the leukemia cells in your garden, and they take over. They just like what happens in my garden sometimes is the weeds take over and they knock out the healthy flowers. And so the way we treat leukemia is by giving chemotherapy to get rid of the leukemia cells. Now that temporarily can get rid of some of our healthy cells as well, and then we ask the seeds to regrow. And I think the leukemia and weed analogy is really good because sometimes you don't see the weeds in the garden, but you know they're deep down. And that's why it takes so long to treat somebody with leukemia. And so your friends that are going through treatment for leukemia, they are kids or adults who need to have treatment longer because those weeds are really deep down. And you have to remember, you don't have leukemia if you have aplastic anemia. You don't have the same problem in your garden. So your treatment's going to be different. And so I think that's one of the things that I see on our floor is the kids with aplastic anemia become friends with the kids with leukemia, and they have different treatments. And it's important to understand those differences. It's important for the parents to understand those differences. It's important for the doctors to understand those differences. And it's important for you kids to understand those differences because your treatment is very much based on what happened to the garden. So we don't treat everybody the same. Any other questions?
Why do I have bone marrow failure?
Why do you have bone marrow failure is a great question. The way I view the bone marrow garden failing, sometimes people are born with what's called an inherited bone marrow failure syndrome. And so that's one of the really important things for the doctors to separate out. Do you have inherited bone marrow failure, or do you have acquired aplastic anemia? If you have inherited bone marrow failure, it's one of those things you were born with. You've got no control over that. If you have acquired aplastic anemia, which is what most of you kids have, or most of you adults have, it really is, for lack of a better word, bad luck. We usually don't know what causes it. We don't know what causes those T cells to become traitor cells. It's often a response to some virus that you have absolutely no control over. So we know it's not because you ate a hot dog. We know it's not because you were out playing. We usually don't know. And it's really frustrating for people because they always want to know why they have the bone marrow failure. Most of the time, we really don't know.
How do I explain to my friends what bone marrow failure is?
So the way I would explain it to my friends is I use the garden. I would tell your friends that your bone marrow is not working right. And you can tell them that bone marrow is the garden where your blood cells are made and that your bone marrow garden is empty. I've got another family that instead of the garden, they use batteries. They use the bone marrow as a battery, and that gives charge because the little guy likes to be energetic. I think when you talk to your friends, they need to understand that in your bone marrow, you have an illness. And that illness, instead of being a runny nose or a cough or a cold, is too few cells. And that's how I would explain it to your friends.
Why can't I play sports?
When will it be safe for me to do normal activities again?
So going back and getting into life and doing sports and playing things and going to school, really are up to mom and dad and the doctor. But I'll give you my answer. It's when your red cells get big enough, you have enough red cells to be strong. For going back into school, white cells and platelets. White cells, can you be around people that are sick? Guess what? In school, your friends are going to be sick. So sometimes mom and dads like to keep kids out because they don't want you to get another illness that may slow down those stem cells from recovering. Playing sports, that's the platelets. And so you could have a good hemoglobin, which makes you strong. You could have a good white blood cell count, helps you prevent infections. But playing football, playing soccer, doing horseback riding, that's the platelets. And with bleeding, it's location, location, location. We doctors and your parents don't care if you get a bruise right here. We really don't care if you get a bruise right here. We care if you get a bruise up here. We don't want you to have bleeding into the head because that can cause permanent damage. And so every doctor and parent is different. And so you work out with your doctor what kind of sports you can play. Various sports have various level of contact. I'll let a kid do dance a lot earlier than I'm going to let a kid play football. And we have to remember, basketball can be a contact sport, volleyball can be a contact sport, baseball can be a contact sport. It really is time to sit down with your doctor and decide what that number should be.
Cyclosporine tastes terrible. How can I get my parents to hide the taste?
Complaining about cyclosporine is a real common complaint. It does taste nasty. Everybody tells me it tastes nasty. My nurses tell me that chocolate milk is one of the best ways to get rid of that taste. And learning how to swallow the pills. Practicing with M&Ms, learning how to swallow the pills, because the pills don't taste as nasty as the liquid. And so as you get older, work on switching to that liquid. The other thing you can do is talk to your doctor. There are other medicines that might be substituted for the cyclosporine. Prograf is something that we have used for kids that just can't take it. It's really important to take your medicine. Really, really important. Don't try to outsmart the body, because that cyclosporine is working on those traitor cells. It helps cripple those traitor cells and not let them attack those stem cells that you're trying to regrow. And so please be honest with your doctor. Please be honest with your mom and dad. And if you just can't take it, talk to somebody about it.
Thank you, Dr. Gabe. That helps.
What is ATG? How do they make it?
ATG is a really cool medicine if you think about it. There are two types of ATG. One comes from a horse. The other one comes from a rabbit. And the way the drug companies make these, it's kind of cool. They take T cells from healthy humans that are usually lost. They take T cells out of a human, usually from a thymus, which is where the T cells live. When people have heart surgery, sometimes little pieces of the thymus tissue get taken out, and they get given to the drug company. Those healthy T cells, so these are healthy T cells, not sick T cells, get put into an animal, either a horse or a rabbit. And in biology, when we put things into other species, they make a protein called an antibody. And all ATG is an antibody, a protein that comes from either the horse or rabbit, and it's purified, and that antibody then can attack the human T cell. And so that's how it works. It attacks those traitor cells that you're making, because it's a protein from another animal to attack your T cells. It's kind of cool, kind of scary. No, you won't start eating hay. No, you won't start running around like a rabbit. But we sometimes have fun with that in clinic, because we've had some siblings make fun of what the horse or the rabbit. And I think it's really important for the doctors to know that the horse and the rabbit are different. And I think that it's one of the things you want to make sure mom and dad understand, that you're getting treated with the right type of ATG.
Are there side effects from treatments like ATG and cyclosporine?
There are lots of side effects to every medicine we use. And I kind of view things as, what are the side effects that are going to happen that are going to be annoying? And then what are the side effects that are going to happen that could be serious? Let's go with ATG first. We give ATG in the hospital. Why? Because it's a medicine that comes from a horse, most commonly, and it's a protein that comes from a horse. And when we put proteins from other species into you, a human, you can have allergic reactions. So you can have hives, you get rashes, you can have some difficulty breathing with a cough or some wheezing. You can get some blood pressure changes. Your blood pressure might go up, your blood pressure might go down. And so we give ATG in the hospital. In my hospital, we always start it in the morning. We want everybody around, and we watch you for those side effects. Cyclosporine has some side effects as well. We've already talked about it tastes nasty. I think that's a side effect. It can cause hair to grow in places you don't want it. I've got a lot of kids that call it the unibrow medicine. It can cause your gums to grow too big. Those are annoying. The medicine, cyclosporine, can cause your blood pressure to go high, your kidneys to be damaged. And that's one of those more serious ones. And that's why you have to go to the doctor, get your cyclosporine level checked, and make sure we're not using too much cyclosporine, which can hurt the kidneys, or too little cyclosporine, which may not work as well. ATG and cyclosporine together can make you at a higher risk for infection. Remember, they're crippling those Trader cells, and those Trader cells are white cells, and so sometimes some of the healthy white cells get knocked off. And so you may have a higher risk of getting an infection from those medicines. Sounds kind of weird because that's the original problem. You didn't have enough white cells. You can't fight certain infections. And so when we're using the medicine, that can also cause infections to be a problem. And that's why it's so important to work with your doctor to see what infections we're worried about at what time.
ATG and cyclosporine or a bone marrow transplant? How do my parents decide?
So when deciding how to treat any disease, it's all boils down to what we call risk and benefit. There's always balances. There's no perfect way to treat anybody. And the way doctors do that is we look at data. And data is a fancy word for how have other kids or other patients done with a various type of treatment. And so the way we do it is doctors sit down with parents and kids and review the data. And it really should be an individual decision because each child has his own views of the world. Each child and each set of parents have their own way of looking at various risks and various benefits. And so what we do as doctors is to sit down with mom and dad and review the data, review the outcomes, and make a recommendation to your parents. And we do that together. I often sit in clinic with the patient. If you're over the age of 3 or 4 or 5, you get to hear about what's going on here, and you get to understand what's going on. And particularly if you're 9, 10, 11, 12, you should understand the differences between the treatment, and you should get a say in how that goes. And that's how we do it. We do it together. And I think, and the togetherness is really understanding the risks of each treatment and really understanding the benefit of each treatment. And our goal is for you to be a long-term quality of life survivor. We're hoping that this is just a speed bump in your life. And it's going to be annoying for a short period of time, but our goal for every kid is to figure out a way to have the risks and benefits balance out so you can go on and do whatever you want, whatever your dreams are.
If I have bone marrow transplant, what should I expect?
If you have a bone marrow transplant, what you can expect it just depends on how the transplant is done. I think you can expect, what I always tell kids is you can expect at least 4 to 6 weeks in the hospital. I think you can expect to come back to our clinic a lot for the first couple of months. I think you can expect some side effects from some of the medicines. But I also think you can expect to be well and be back into life within a year. And so we usually set a goal of about 6 months to get back into school. Kind of depends when school's going to be. Remember that colds and flus tend to come around in January, February, March, and so sometimes we have to hold kids out of school then. But Our transplant survivors, we expect them to be well, we expect them to be healthy, and we expect this to be a speed bump. Doesn't always happen that way. There are some situations where we have more side effects. There are other situations where we have less side effects. But to really understand what to expect, you have to sit down with your doctor and really decide what are the details of that transplant. Because every kid has a unique experience.
Will I always have to be checked for bone marrow failure?
I don't think you always have to be checked for bone marrow failure. I think that depending on how you are treated, over time you'll get to worry less and less about it. I think everybody takes a souvenir away from having a illness when they're young. And so if you were treated with immune suppression, your doctors as you grow older will need to know that. If you're treated with a bone marrow transplant, your doctors you'll need to know that over time. But the farther away you are from the treatment, the less you need to worry about it.
What kind of questions should kids ask?
Kids ask great questions, and you have to ask questions when you're a kid. Don't be afraid to ask a question. I think that some of the great questions are, when can I play with my friends? When can I go back to school? Why am I taking this medicine? And explain to me these things. And I think that when kids, if you're thinking about it, ask it. It really is really important, because sometimes you're going to ask the question that your parents wish they knew the answer to. And so kids are smart. Kids are really, really smart, and never, ever be afraid to ask a question. I love it when kids challenge me. Sometimes kids will say, can I go to a ball game? I have to be able to think of a really good reason not to. And so I think that most of the time when a kid asks the question, they're getting right to the heart of the matter, and the doctors have to be able to answer that.
Thank you, Dr. Dave.
This program is brought to you by the Aplastic Anemia and MDS International Foundation.